और चैट बॉक्स मैंने खोल दिया और स्क्रीन शेयरिंग मैंने कर दी। कैन यू सी दिस? मेरी स्क्रीन नजर आ रही है? शेपिंग प्रोफेशनलिज्म, मेडिकल ओथ्स एंड कोड्स ऑफ एथिक्स। Anybody can respond to me? Okay,
Yes,
perfect.
sir. Yes, sir.
मैं स्क्रीन नहीं देख रहा था तो इसलिए मुझे अंदाजा नहीं हुआ, मैंने दूसरी साइड पे की हुई। ओके, दैट्स परफेक्टली फाइन। सो लेट्स स्टार्ट फॉर टुडे। Shaping professionalism, medical oaths, and codes of ethics. So, when we talk about codes of ethics, I'll be talking more today related to your clinical situations rather than the typical bookish knowledge that you already have prepared in your behavioral sciences classes at undergraduate level. So, a step forward from that, we will move forward. ये एक छोटा सा कथा शुरू करते हैं। उसमें जो पूछा आपका मुझ पर ध्यान नहीं जाता, तो हंस के कहते हैं मुझसे कि हाँ नहीं जाता। अजब तरह की मसीहाई है तेरी मेरे दोस्त, कि जख्म भरता तो है पर निशान नहीं जाता। So usually when we are talking about medical ethics or code of ethics or general situations like this, we have to talk about multiple situations. मसलन एक scenario है, should physician use surgical placebo controls? Subjects undergo surgical procedures that have the appearance of therapeutic intervention, but during which the essential therapeutic maneuver is omitted when assessing the efficacy of a surgical intervention. So now this is a real life situation. If one of my friend, a surgeon who wants to conduct a study whether this say gastrostomy will work for this many kind of patients, and is it ethical then that I will put a control there so that half of the people will be going for it and half won't, and I will see the efficacy of it. So does it really matters that we should do that? Now, the use of placebo control is not justified when testing a surgical technique that represents a minor improvement of an existing surgical procedure. Now, the reason I placed this example was, if you want to generalize it, anywhere we are using placebos in any of the experimentation. So all of you people will be doing some research in times to come, and you do as a part of your FCPS training as well. Any place where the placebo is used, there need to be some answers that should be provided. When a new surgical procedure is developed with the prospect of treating a condition for which no known surgical therapy exists, using surgical placebo controls may be justified, but must be evaluated in light of whether the current standard of care includes a non-surgical treatment and the benefits, risk, and side effects of that treatment. Now, this situation applies to all of the situation. So anywhere that you want to test something new and you want to make sure that the controls are existing, and you want to use some kind of a placebo which can give you a balance that this was done and this was not done and this was the population, how it will work. So you have to be careful, because placebos usually don't have their own therapeutic values. And when it is called placebo because it is actually an inert substance which is similar to the original substance, whatever it is, and then you evaluate it after some period of time. Now, is it justified that we devoid patients of the treatment for certain period of time just to conduct a research? This is a tricky situation, and lots of debates been taking place in it about it. So if I'm checking a new drug, say I did a trial of lurasidone in bipolar patients in Pakistan, and I was giving placebo to patients as well. Now, the point was, it was a new indication for a new drug marketed in a situation. Can we use the placebo? There is a big argument about it. So lots of research papers have been conducted why it should not be used, and there are rationales why they should be used. So in clinical situation, if this is the question that is asked from you, if a placebo is to be used in patients, actual patients, and comparing them with the substances or whatever the procedure in actual population and the other population, so how do you want to go for it? There's a big protocol about it. So you have to make sure that the people who are actually giving the consent for the research study, they should be aware of whole of the protocol. They should be aware of the fact that they may get the original thing or they may get a placebo. They are willing to face the consequences, blah, blah, blah. So make sure that when you are responding to this question, you have to be very, very careful. During the informed consent process, careful explanation of the risk of the operation must be disclosed. Additional safeguards may include using a neutral third party to provide information and obtain consent. So if you are the investigator and you want to do some procedure and you want to see the effect of actual thing and the placebo and comparing them and publish a research paper, ideally speaking, the informed consent should be taken by a third party. So you should not be involved in the process of taking the consent. This is very tricky, but ideally this should be done. And that third party should be able to tell all the people involved in the study same situation, all the documentation, all the verbal content, all the details about it should be disclosed to the person before proceeding it. What we do is usually, आपको पता है हमारे यहाँ informed consent यहाँ पे दस्तखत कर दें and people sign it because the doctor is asking for it. So people do consent. That is not appropriate at all. Informed consent, you all know how to take it and how to proceed with it. So you have to be careful. Now, another thing, what are physicians' reporting responsibilities if a patient's medical problems impair his or her ability to drive safely? हमारे यहाँ सड़कों पे गाड़ियां चल रही हैं, गाड़ियों में ड्राइव कर रहे हैं, लोग लाइसेंस के बगैर गाड़ियां चलाते हैं. 90% of the time people don't have the license and they are driving the vehicles. In rest of the world, this is not like that. If you're driving a vehicle without a license, you can be sent to jail for it for a longer period of time as well, because it is considered to be a major crime, not a small thing. It's a major crime. So if your capability to drive is impaired, and as a physician, as a psychiatrist, I see that this person is incapable of driving safely for himself, herself, or the people around, what should we do? Ideal situation. Impaired drivers and their physicians. Physicians should use their best judgment when they are assessing when to report impairments that could limit a patient's ability to drive. So, choti si misal, emergency situation mein, I usually try to give examples from my own perspective in a real life situation. So, one of the patient develops an epileptic seizure. That patient was taken to an emergency. That was the first time he developed an epileptic seizure and was presented in emergency. So the first thing people in a developed country, what they do is they assess the risk and the benefits and they write a note to the motor authority and suspend their license. In situations where there is a strong threat to the patient and public safety and where the physician's advice to discontinue driving is ignored, it is desirable and ethical to notify the State Department of Motor Vehicles. Even in this situation, even if the patient don't want to drive, most of the time, the ER physicians working in the developed countries, they report to motor authorities and they suspend the license. And that suspension is reviewed subsequently in 6 months, 1 year, and 2 years' time. So after the 6 months, if there is no epileptic seizure, everything is okay, the investigations are normal, the patient is given the license back with safety and precautions, all the things given to them, and they can start driving. But again, the physician has to decide if he is again back to the fitness to drive or not. Motor vehicles, driving on the roads is a risky business. Every now and then we see multiple accidents happening. Lots of lives are lost because of it. In Pakistan, unfortunately, this is not checked, but this is an important issue. So, as a psychiatrist, if you are asked or if you move away from Pakistan to any other country, you should be aware of this fact. Results of an experiment that does not meet contemporary standards of human subjects. Protection is submitted for publication in a medical journal. What should the editors do? So जब भी हमारे बहुत सारे जर्नल्स पाकिस्तान में छपते हैं और उनके आर्टिकल्स को रिव्यू किया जाता है, wherever there is a human involved in a research study, wherever, you have to take a written informed consent. If the ethical requirements are not met during the proceedings of an experimentation, then the editors have the right not only to reject the article, but also report it to the appropriate authorities as well. If data from unethical experiments can be replaced by other sources of sound data, then the results should not be published at all. If the data from unethical experiments are scientifically valid and are the only data available and necessary in order to save lives, then publication of such information may be appropriate. So, this COVID vaccine, lots of papers were published about it, and the vaccines available in the market these days, they are from multiple sources. Some of the vaccines were actually don't have the published data. They were actually in the live population. So like if one country developed a vaccine, it starts giving it to all the population around in that place, and then seeing the effect of it after that. Sometimes these data are acceptable as well if is a life-threatening situation. But again, there is a lot of paperwork involved in it. So it won't be accepted right away. It won't be accepted right away कि आपने कहा कि जी ठीक है ये वैक्सीन हमने डेवलप कर लिया और ये सारे पाकिस्तान को लगा दी जाए, सारे पाकिस्तान बच जाएगा. जो मर जाएंगे उनको बाद में देखेंगे कि ये क्यों मर गए थे, वैक्सीन से मर गए थे कि इन्फेक्शन से मर गए थे. So yes, it is doable in certain situations, but again, lots of paperwork needs to be done. There are definite rules and regulations and the paperwork which is available for such kind of situation. And unless or until is a global threat these days like COVID, you cannot utilize the medication in a life situation. ये एक खूबसूरत गजल अगर जल्दी से पढ़ दूं तो लोगों को इतराज ना हो तो. ओके, एनीबॉडी हैज एनी ऑब्जेक्शन, लेट मी नो. कभी रुक गए, कभी चल दिए, कभी चलते चलते भटक गए, यूं ही उम्र सारी गुजार दी, यूं ही जिंदगी के सितम सहे. कभी नींद में कभी होश में तू जहां मिला तुझे देखकर, ना नजर मिली ना जुबान मिली, यूं ही सर झुका के गुजर गए. पाकिस्तान में खामोश मोहब्बतें बहुत ज्यादा होती हैं. So one-side love is always there, and most of the time in the teenagers there is a crush. कभी जुल्फ पर, कभी चश्म पर, कभी तेरे हंसी वजूद पर, जो पसंद थे मेरी किताब में वही शेर सारे बिखर गए. मुझे याद है कभी एक थे मगर आज हैं जुदा जुदा. वो जुदा हुए तो संवर गए, हम जुदा हुए तो बिखर गए. कभी अर्श पर, कभी फर्श पर, कभी इनके दर, कभी दर बदर. गमे आशिकी तेरा शुक्रिया, हम कहां कहां से गुजर गए. It was a beautiful गजल by परवीन शाकिर. I liked it, तो मैंने कहा मैं मौके का फायदा उठाऊं और आपको सुना दूं. I hope you people are still there. Okay. अगर इधर उधर हो जाओ तो मुझे मैसेज कर देना, मैं फोन सामने रख लेता हूँ क्योंकि जब ये थोड़ी सी आवाज आती है तो I am careful that I hope I'm not. Okay. Naila, you have to join back again, or if you are joining from the cell phone, you just have to move your screen and you'll be able to see me, see the screen. Information from unethical experiments. If the results are published, the editor should include a disclaimer that clearly describes the unethical nature of the experiment, clearly states the publication of the data is needed to save life, pays respect to the victims. Only then things can be proceeded. Furthermore, if the results are published, the editor should include disclaimer that avoids trivializing trauma suffered by the participants, acknowledges the unacceptable nature of the experiment, and endorses the adoption of the higher ethical standards for human subjects protection. Now, this is, I'm talking in relation to the COVID, so you have to be careful. Another ethical scenario, a student is uncomfortable about medical students performing procedures on each other for educational purposes. How should the physician educator respond to students' concern? So मेरे पास एक मेडिकल स्टूडेंट आता है, बिहेवियर साइंसेस का इम्तिहान हो रहा है, वो कहता है जी ये आपने जो मुझे एक्सपेरिमेंटल के तौर पे डमी के तौर पे बिठा दिया है कि वो आए और मुझे एग्जामिन करें या मुझसे सवाल पूछें या मुझसे बात करें. So ethically, is it appropriate or not? Now, what should we do? Instructors should explain to the students how the procedure will be performed, making certain that students are not placed in situations that violate their privacy or sense of propriety. The students should be given the choice of whether or to participate prior to entering the classroom. And there should be no requirement that the students provide a reason for their unwillingness to participate. Students should not be penalized for refusal to participate. So, this is important. पाकिस्तान में उसूल ये है कि स्टूडेंट ने मुझे कहा जी मैं ये नहीं करना, तो मेरा पहला सवाल होगा क्यों, right? First response, which usually we all give when somebody says no, is why. That's tricky. Ethically speaking, we should not ask the reason from them, and we should not penalize from them. We should not corner them. So if one of my residents says, I don't want to do this, the first response, my natural response would be why. But actually it should be, okay, fine. You don't want to participate because you feel that there is some complication associated with it. If you feel comfortable, please convey me your reservation. That should be the ideal way of getting things and correcting yourself rather than penalizing the student, right? So अगर बिहेवियर साइंसेस का इम्तिहान हो रहा है और आपने डॉक्टर बिठाए हैं और डॉक्टर कहता है जी मैं नहीं बैठना, ये बड़ी अनकंफर्टेबल सिचुएशन है, या जो भी उसकी रीजन है, डोंट आस्क व्हाई, आस्क देम okay fine, it's comfortable, go ahead. And maybe at some other time you can ask them informally, okay, that thing is over now, were there any complications associated with it, was there anything wrong in it, do you think that it can be improved, how do you think we can improve this situation? This is how we have to proceed rather than asking them kyun nahi bana, chal beh ja. No, we cannot do that ideally. Or इसको हम unethical जुमरे में नहीं लेते, which is again a tricky situation. Ideally speaking, we should take it as serious because this happens very commonly in our medical college setups, usually in Pakistan. When residents or medical students are part of the healthcare team, what consideration must be taken into account by the attending physicians when billing for services? So यहाँ पे जब ये पाकिस्तान में लागू नहीं होता, so इसलिए मैं इस पर ज़्यादा देर नहीं लगाऊंगा. यहाँ पे हमारे साथ जब हम क्लिनिक्स कर रहे होते हैं तो हमारे साथ मेडिकल स्टूडेंट या रेजिडेंट्स मौजूद होते हैं और उसके बारे में एक अलग से बिलिंग कोड्स हैं जो हम सरकार को चार्ज करते हैं और सरकार हमें पैसे देती है. तो क्योंकि पाकिस्तान में ये अप्लाई नहीं होता, सो आई विल जस्ट स्किप दिस. Again, another ethical scenario. Should consent be obtained before filming patients for commercial programs that will be publicly broadcast? Now, this is a very, very unfortunate situation, but I see lots and lots of psychiatrists making some of the files public, right? ये जो व्हाट्सएप ग्रुप बने में इस पे मुख्तलिफ, इवन मैं छोटी सी मिसाल दूं कि कोर्ट ऑर्डर टेलीकास्ट कर दिया गया एक व्हाट्सएप ग्रुप में कि फला मरीज को ये डायग्नोसिस के बेसिस पे जो है वो सजा माफ कर दी गई. So the psychiatrist did an excellent job by actually reproducing himself in front of the court, justifying it and saving a life. But is it ethical that it can be projected in a WhatsApp group where there are a number of other people in as well, besides the psychiatrist? What are the possibilities कि ये ऑर्डर, जो भी ऑर्डर था, वो पब्लिक हो गया है तो कहीं और नहीं पहुंच जाएगा? बहुत पॉसिबिलिटीज है कि वो कहीं और भी पहुंच जाएगा. और अगर पेशेंट का नाम उसमें है या पेशेंट की डिटेल उसमें मौजूद है और अगर उसका डायग्नोसिस मौजूद है, तो क्या ये होना चाहिए? नहीं, ये नहीं होना चाहिए. यहां पे भी दिस सिमिलर काइंड ऑफ सिचुएशन. एक टीवी वाले आते हैं, मरीज से पूछते हैं, पूरी प्रॉपर कंसेंट लेते हैं उससे कि हमने आपकी फिल्म बनानी है, इस फिल्म में हमें ये दिखाना है और आपकी इजाजत चाहिए, और मरीज कहता है हाँ जी इजाजत है. तो क्या ये ब्रॉडकास्ट हो सकती है? Filming patients without consent for commercial purposes is violation of the patient's privacy. Consent is therefore ethically required for both initial filming and subsequent broadcast. आपके लिए जरूरी ये है कि आपको ना सिर्फ मरीज से रिटन इन्फॉर्म्ड कंसेंट लेनी है अबाउट द फिल्मिंग, आपको उसको फिर उसकी ऑडियंस का भी बताना है कि this will be broadcast in this channel, and this channel would be able to show your movie to this kind of a population. Do you agree with that as well? And again, it's not such simple as I'm telling you. It has to be very formatted and sequenced. So अगर मरीज कंसेंट दे भी दे तो आप उसकी फिल्म नहीं बना सकते, या बना सकते हैं तो उसको ब्रॉडकास्ट नहीं कर सकते, जबकि ब्रॉडकास्ट के लिए अलहदा से परमिशन उससे लेनी पड़ेगी. और उसमें जो भी डिटेल्स हैं वो वही बेसिक प्रिंसिपल्स जो आप बिहेवियर साइंसेस में पढ़ते हैं, 4 प्रिंसिपल्स, वो उनके बेसिस पे आपको उससे परमिशन लेनी है. Now, ethical scenario. A contract research organization is recruiting physicians to participate in clinical trials that involve patients to whom they provide care. What ethical issues do physicians have to consider? So, मेरे पास एक फार्मास्यूटिकल कंपनी आती है, वो कहते हैं जी हमने ये दवाई लॉन्च की है और इसमें इतने पेशेंट्स को आप ये दवाई दें और पेशेंट्स के ये मसाइल हल हो जाएंगे. तो